So we are going to talk about muscle testing and hormone replacement therapy. We don't have the music today, but I want us all to dance in our head. I know Dr. Grable loves to dance with me on Zoom, right, Dr. Grable?
I dance in my head all day. Yeah.
Exactly. So if you have any questions, for those of you who are joining us now on YouTube, and once we start the broadcast, that's when the podcast people join us. But if you're joining us on YouTube and any of the things that we say, you're welcome to email at any time. But today we're going to talk about muscle testing, like I said, and hormone replacement therapy. So fasten your seatbelts because we're going to learn and grow together. Hello, my listening friends. It's so nice we can meet each other on the air on this beautiful, best day ever. And for those of you who are new to the Lillian McDermott radio show, I have been waiting for you. Please know that this is a safe place where you can go to when you need a friend. It is my commitment to provide alternative ways to heal, and it is my mission to make awareness, responsibility, and truth a part of our everyday life. And I hope you, my listening, as well as my viewing friends, so you can join us at facebook.com/Lillian's radio show, will feel empowered to embrace a new truth and live the life of your dreams. Now, part of living the life of your dreams is finding the right practitioner, doctor that will listen to you and be able to help you with whatever crisis you have or prevention you want to achieve. And I'm so grateful that we have Dr. Stephen Grable. He is the founder of Complementary Care Center in Jacksonville Beach, Florida, but very, very close to Southeast Georgia, Orlando. But where I go, I get to work with Dr. Grable also on Zoom. It's so nice to be able to have flexibility and have a doctor that looks healthy, like the way you want to feel, like the way you want to look. And so today I asked Dr. Grable to talk about some of the specialty. Right now, Dr. Grable is working with me with hormone replacement therapy. So we'll probably interject some things there because I'm experiencing, after the explantation, some issues with my body. And so I am grateful that Dr. Grable is here to talk about not only hormone replacement therapy, but muscle testing. What is that all about? And how do we communicate through this muscle testing with our practitioners, our doctors? And so Dr. Stephen Grable I am ready to share his wisdom. And I am so grateful because it is our sole purpose in life to give and receive love and knowledge. And thank you, Dr. Grable, for not only being a sponsor, but a good friend who is here to share your wisdom.
Good evening, Lily.
Yes, it's so nice. So let's talk about muscle testing. That's the first thing I want to talk about because I've always been very curious about muscle testing, and I wonder how people get involved and how do you know that muscle testing is the right thing for you?
Well, muscle testing also goes by the term kinesiology, and it's not to be confused with muscle testing like you get if you went to see a physical therapist who would be, testing the strength of your muscles to see if they were appropriate or not. This is really a way to sort of have a communication with your body. And you can learn to muscle test others. You can learn to muscle test yourself. And I just find it very useful in my practice. I wouldn't make life or death decisions based on it, but it's a tool and it can provide information. This dates back to Dr. Goodhart, I don't know, probably 50 years ago now, who was a chiropractor who really brought this to light. And so it has been duplicated over and over again. There's a Dr. Omura. I don't know if Lily, if you've ever heard of him. He's a Japanese MD. And he developed a system called O-ring testing, where you can essentially use any muscle group. And some of your listeners may have seen some of the, pushing down on the arm routine. You can use any muscle group. But he actually did studies proving that O-ring testing was valid. And what you do is is probably easier to learn for the people watching is to use the deltoid muscle. And I keep it real simple. So the first thing I do is you're going to push down, you're going to ask them to resist you. And then you get a feel for sort of how strong their arm is. And I'll ask them, I'll just say, show me yes, and I'll push. And I'll say, show me no, and I'll push. And in my thought process, yes is strong, no is weak.
Okay.
So usually you can get a feel. If you can't, I'll try to do it a couple of times. And then once I feel like I can have a good idea between yes and no, then it's very important to ask their body, as they say, if you have permission to work with them. Once in a blue moon, you'll get a no for whatever reason. Maybe think this is kind of hokey pokey or something, or maybe they're afraid or something like that. And then you have to kind of explore that, because you don't want to muscle test someone, even though they may seem to be cooperative. If their bodies are having an issue for whatever reason, you want to get that resolved ahead of time. I can't remember the last time that happened. And I muscle test daily on patients, so it's usually not a big deal. So you establish, you get the strong, weak, you get permission to work with them. And then it is incredible what you can do in terms of asking. You can ask, it's like sort of like you're talking to their subconscious. That's kind of a way to think about it. And for the moms out there, this is a great tool, because your kids cannot lie to you.
Well, they can try. They can try,
but I've had professional football players in my practice, and I've muscle tested. And these are guys that, they'll put their arm out, and you could literally do a chin up on their arm.
Yeah.
And you get a no, and they go down like a ton of bricks, and their eyes get like this, and they're just dumbfounded at the process. So some people will test supplements, for example. Let's say they bring in a vitamin they're not sure of. I'll have them hold it next to their body, and I'll muscle test them. And if they go weak, that is kind of energetic information that their body does not like that supplement. If they hold strong, then tends to indicate to me that they would like that, and that's good to use. But you can ask them anything you want. Yes, no questions.
So you're doing the asking, the body is responding. Subliminally or subconsciously, the body is communicating with the practitioner, the doctor, whoever is doing the testing, you at this point. But how do we know? Okay, this is not a question with you. I know that the integrity that you have. A long time ago, I was muscle tested by someone who just happened to have all the vitamins that my body muscle tested. And and some of these vitamins just didn't do very well with me. And I kind of developed a position, maybe it was my limiting belief, because afterwards, at first it seemed like it was pretty cool, but then I thought, how do I know that my body is communicating with the doctor versus the doctor is manipulating me, because those are the vitamins? What are some of the things that we need to look for when we are doing muscle testing?
Well, one of the problems that I have is I have patients, they want to do it. They want the information, but they're trying to help me. And I can tell, because it'll be inconsistent. They'll be no, and it should be yes, and vice versa. And I always ask something several ways. So for example, I like to do O-ring testing, where I can't really demonstrate because I don't have 3 arms, but you put your fingers like this around each finger, try to pry the fingers apart.
Like this?
So, well, you can do it this way, but I do it where, let's say their hands here, if you can pretend, and then I put my fingers around each finger like this, and I try to pull this way. I try to pry their fingers apart.
I see. Okay.
Pry their fingers apart.
So we put our fingers together.
And I put around each finger like this, and then I pull, and I get a feel for how strong they are. Mm-hmm. Okay. So yes is strong, no is weak. So I'll do this, and I do it very quickly. And so I'll say, show me yes, show me no, do I have permission, and so I'll say, is your belly pain due to a virus, and it'll hold strong. So that's a yes. And then what I do is I'll ask, is there any reason to doubt this answer? And that should be a no. So one way to guarantee that you're getting yes, no, is to ask a question that it has to be one of two pathways. So is your problem a virus or not? See, it's got to be one or the other. See, if you ask something that it could be this, or over here, then you're not really quite sure. Are you following?
Yeah. But when you're answering a no, let's say, is there any doubt in this answer? If the answer is no, is that a weak response or a strong response? So if the response,
so in my, you could have it the opposite if you wanted to. You could have no is strong and yes is weak, but that intuitively doesn't make a lot of sense.
No.
So what I try to do is I try to do it fast. To answer your question about the ethics,
yes,
that's up to the practitioner. Needs to have no vested interest in the outcome, and that's hard. That's why I like my Asira machine, because it's kind of like an electronic muscle tester.
Yeah.
But I try very hard. In fact, with me, I probably don't sell as much stuff as I could because I'm very aware of that exact problem that you're bringing across. And I do not want to sell somebody or have somebody do something just because I want it or because I think it.
So you think that is possible for some practitioners?
Absolutely. That's why you always take muscle testing with a certain grain of salt. In fact, Lee Cowden at the ACIM meeting talked about how, you've got muscle testing and you have like a Zyto or the Asira machine or one of these machines. If muscle testing is positive, that gives you a little indication there might be something going on. Yeah. Well, let's say this is positive and the Asira is positive. Well, now you have a little more credence in it. Well, let's say you do 2 muscle tests and 1 positive. Now you're going, hey, this is looking pretty good. You get 2 and 2, you can go to the bank on it.
Very good.
So, you're taking this all into account with everything that you see with the patient. Is this consistent with their history? Is it making some semblance of sense to you?
Yeah.
But again, I wouldn't base a medication choice, certainly not anything radical based on muscle testing. That would be nuts. But it's information, and it can often give you clues to maybe have you go down a path that you might want to explore that path. Mm-hmm. It's a detective game. So we're trying to figure out what are these roadblocks along the way that we need to move out so that you can get to a place of health and healing. But I give patients another technique, and you may have seen this where
we lost.
Help to stand. You have an item. We'll say this is a piece of fruit, okay? So you're at Publix. You put that up next to yourself. If you lean forward, your body wants it. If you lean backwards, your body doesn't want it. And that kind of makes sense intuitively. I have patients that have gotten incredibly good with this. They can go through and they'll pick up a piece of fruit, will test bad, good, throw it in their basket. They get very quick with it. So go ahead.
No, I've heard about that. And so that's the way that we can test ourselves, right?
Right. And the way I tell patients to practice this is do this blinded, where you have a container where you have something you absolutely know is good for you and something that's absolutely bad for you. And have a loved one or somebody hand it to you without your knowing. And just practice with this. And I'll tell you, this stuff, it really does work. And if nothing else, the fact that this has been reproduced by so many tens of thousands of practitioners, that alone has to let you know that there's really something going on here. And I think what's happening is we're connecting with their energetic field. That's what I think is really going on. And their answer is reflected in the strength of their muscle. So that's what I think what's really going on.
I love it. I love it. And I would like to see more people holding fruits and vegetables to their chest and, testing to see if they go forward or backwards. Do you have to close your eyes at that point, or can your eyes be open?
Your eyes can be open. You just have to be accepting of the outcome.
Very good.
It's kind of like when you pray to God, if you have a preconceived notion of what you want, you may not be receiving what he's really trying to teach you.
Correct.
You just have to be a blank slate and not really care. In fact, sometimes some of the best muscle testing, when you're sitting, I'll be O-ring testing and I may be just letting my mind drift. I just kind of do it mechanically.
Mm-hmm.
That's probably the most accurate testing, because then you're keeping your mind out. You're just receiving what they're trying to communicate to you.
We're constantly communicating with one another, and it was so funny. I was with my parents yesterday, and I was walking the hall, and my dad responded to my mom, and my dad went forward, and my mom looked at me, and the way she looked at me, I knew exactly what she was thinking.
Yeah.
And it was so funny because here they've been married like 64 years, 65 years, and it's still like I go into their field of energy, and that's why we need to be careful with who we surround ourselves with. I'm not saying that you can't surround yourself with people who are not like-minded, but feel the energy.
You can feel them. Absolutely.
Yeah. So one of the last things I want to ask you, I was at and what I love about Dr. Grable is that although he's an MD and he has certifications and all the things that help him be integrative, he still continues education. ACIM is where I met him last year. It's our 1-year anniversary. And so you were like learning this new tool, and people there are just like thinking outside the box. Well, this woman who I believe works with Dr. Cowden, she's a beautiful woman. She was using it looked like a stone, looked like an arrow. It was a triangle, and she had it on a sterling silver kind of like a necklace, kind of like a string.
As a pendulum.
And a pen, yeah, okay. So she would put it on top of a product. Is this good for me? If it goes up and now, show me yes, show me no. And she was making decisions for her body based on show me yes, show me no. Is this good for me? Is that something that could be used too, instead of waiting on the forward or the backwards, especially if you have an ear imbalance or something? So tell me more about that.
Yeah, well, it's just, I think what happens is that your body will, usually they'll have like clockwise is sort of yes and counterclockwise is no.
Okay.
But Jerry Tennant, I don't know if you remember Jerry.
I interviewed him. I interviewed him.
So Jerry, he probably talked about how he does his analysis and he'll take his pendulum and go through. And it's an art. I've played around with pendulums. I haven't gotten to a place where I feel completely confident in, but I know there's a lot of folks that have gotten pretty adept, and so it's a valid tool.
Okay.
There's all kinds of. I've thought, I would love to play with a Kirlian photography, which looks at your energy field, and of course it's constantly shifting and changing. But as you even think things, their field is going to shift in relationship to even your thoughts. I just think there's a lot of cool ways of getting information and figuring things out. So just play with it. You're not going to hurt anything. And,
Yes. And learn what a real yes is and confirm it. We can be our own researcher for ourselves and how it works for us. Okay. So I love that. So now let's move on, because with muscle testing, we can also test with medications, with hormones, with all of that. So I thought that this was a really good segue for hormone replacement therapy. And so how do you know that hormone replacement therapy is the right thing for each individual, for you?
Well, a lot of it, we'll talk about ladies, and then we can talk about guys. They're a little simpler.
Okay.
So there's three, say four, but three that I wanted to kind of focus on tonight is progesterone, testosterone, and estrogen. So ladies know when they're premenopausal, they can tell these hormonal shifts that are occurring in their body. And, they go through menopause usually in their 40s. I think the average is 47. And so as these hormones start to decrease, they may or may not have symptoms. I've had patients that have gone through menopause and they didn't even know they went through it, only they stopped bleeding. So I guess the big question is I think whether to use hormones or not sort of becomes a philosophy. I was a Jeff Bland devotee. I don't know if you know who Jeff is.
Yes.
So 20 years ago, I started all this alternative stuff. He's a biochemist. I used to go to his meetings. And he was not a big hormone guy because his feeling was that, aging is a normal process of life. And as these things decrease, that's just part of the whole process. Mm-hmm. On the other hand, you have groups like A4M who are the big anti-aging folks. Goldstein and his buddy, they started this group years ago. They now have 40 or 50,000 people come to these meetings.
Wow.
Well, they look at aging as a disease.
Wow.
So a little bit of difference in philosophy. Now, I will tell you that there has not been any solid evidence that taking hormones extends lifespan. So I know that's the whole thing. A lot of times we're wanting, but I personally think that it does help to improve quality of life, at least, because these hormones can affect the brain.
Yes.
Estrogen and progesterone both, I believe, can help protect you against dementias and Alzheimer's and whatnot. Mm-hmm. Estrogen, can help with your skin, with your mood, with, of course, hot flashes. And I've got some sheets here that we can go into more depth depending on how our time goes. Yeah. But ladies that I prescribe this for usually will feel very good. There's a small percent I put on and they kind of go, well, I didn't really see anything. And so we might just stop and that's fine. So what we do is we'll check. I go by blood tests. And I know there's a lot of folks out there that love to do saliva testing. And that's fine if you have a virgin patient. But once you've taken any of these hormones, I think it completely throws off saliva testing. So I've found that I'd rather just do blood tests.
You said virgin? Did I hear you say virgin?
Meaning they've never been on hormone replacement. Yeah.
Okay. Well,
yeah, not virgin in the sense.
I didn't know because I was saying good luck with that.
Exactly.
You got a premenopausal woman there. You're not going to find a virgin very much.
You're right. That'd be pretty rare, right?
I just wanted to clear that. I just saw. Okay. Go ahead.
So anyway, they'll come in, and usually people don't come in because they feel terrific and they want to just tell me that they feel terrific. They usually come in because they're having hot flashes, or maybe they're tired, or they're just, a variety of things. They don't feel good. So we'll do hormone tests. And generally, once a woman has been menopausal for a year or two, usually their levels are fairly low. Mm. So we'll check them just to get a baseline. And then I like to compound progesterone, testosterone, and estrogen together in one cream. And that's nice because it's a little less expensive and it's easy. So they rub just a little bit on twice a day on soft skin. Mm-hmm. And then I will monitor them clinically. If they start to feel better and optimal, then we'll just leave them on that dose. If they don't notice anything, depending on their particular needs, I may adjust that a little bit.
Yeah.
So every woman is treated as an individual based on, and if say we've tried a few formulations and if we're still kind of scratching our head, then I may go ahead and get a second set of blood tests to kind of see where they're at. And so if we have their hormones in what we would call sort of an optimal place, and they're still saying, well, I don't know, I don't think this is helping very much, then we might just stop it, because we don't need them to be spending their money if it's not helping. But the majority generally notice a big improvement.
That's right. They can tell you.
Right.
So you go by the symptom and how the person is feeling as well?
Right.
So let's say the person is feeling exhausted and all the things that may sound like menopause or premenopause, but perhaps maybe could there be another underlying condition? How do you discern if what the person has is, hormonal or it's disease?
Well, that's a good question, because, when you're a year or two out from menopause, your levels are almost certainly going to get low. Mm-hmm. So there's a lot of overlap with various diseases. When you look at, for example, fatigue, I mean, my gosh, it's legion, the number of things you can do.
Yeah.
So if I put a lady on hormone replacement therapy, or HRT for short, and I'll see her back and she says, I'm just not one bit better, that's going to really lead me away from thinking that sex hormone deficiency is a big part of her problem. Just sort of like, usually there's several things going on. We're all loaded with viruses and toxins and all kinds of stuff. And so these are all these roadblocks that I talk about. So as you get these roadblocks out of the way, the picture can start to be clearer. So they may come back and say, I'm feeling better. I like this stuff. I'm still not completely optimal. I'm still very achy. I feel like my lymph nodes are kind of swollen and tender. If I hear a history like that, then I start thinking about more maybe of chronic viral problem. So we'll address that. I always look at thyroid. I mean, thyroid's such a common problem that you got to look at thyroid. My Asira machine gives me a lot of clues as to what's going on with patients. You can muscle test to get some ideas of priorities with people.
Very good. Very good. So does the cream have to build up in the body, or can you instantly feel that this is the right dose?
Usually you'll feel better in as little as a week, 2 weeks at the most. That's pretty typical. If I don't see improvement in a couple of weeks, I may adjust the dose up or down depending on what she's telling me. If, for example, she tells me, when you first put people on hormones, sometimes their breasts may be just a little sore for a week or two. That's not anything to get excited about. If that persists, that usually tells me they're maybe getting just a little too much estrogen. Okay. So I'll cut that back a little bit.
So breast tenderness equates too much estrogen?
Commonly, yes.
Commonly, okay.
Yeah. Now, if they come back and saying I'm still having these terrible hot flashes, then I know that I have to go up on their estrogen. And I've had ladies on as little as 0.5 milligram and as high as 12 milligram. And that's a 24-fold difference. So everybody's unique. I don't know if I ever told you the story. I had a Russian lady. I put her on testosterone. And she comes back, she goes, "Oh, Dr. Grable," she says, "I feel wonderful. What did you give me?" And it was the only time the pharmacy ever screwed up that they gave her male strength testosterone. So I said, I think we're going to have to cut back just a little bit.
Was she playing with her goatee at the time?
I was wishing I had a little more testosterone.
Yeah.
So, that one, testosterone helps with libido, strength, drive, that sort of thing. If they start getting, acne, peach fuzz, obviously they might be getting a little too much. You got to cut back.
So your body's constantly telling you.
Your body is processing 200,000 bits per second. There is no machine that comes close to that. So gals are much better at this than men. Men are kind of, you got to hit them over the head with a 2x4.
Yeah.
But women are very tuned into their bodies. And so they give me some great feedback. And so usually that can kind of direct you, kind of where you want to go with them.
So when you need estrogen, your symptoms are maybe what?
So estrogen, let me pull out my list. So estrogen, can help the brain. Mm-hmm. As I was
So
preparing,
if you're feeling brain fog, it could be that you have a lack.
estrogen deficiency. It also, in my opinion, helps to protect against Alzheimer's, which is nice.
Yeah, but there's a big scare. People go, "Oh, I don't want estrogen because I don't want breast cancer." What's the myth about that?
Great question. So all this goes back to the WHI trial, the Women's Health Initiative. This is the big nurses study 15 years ago, whatever. And it was financed by the Premarin Provera folks. Well, Premarin is over 100 different horse estrogens, and Provera is a chemical progesterone. So when they started getting the results back, they found that these women were actually having more problems and strokes and breast cancer and this and that, and everyone was just amazed and baffled and scared. So all of these gynecologists panicked and said, "Oh, we've got to get women off hormone therapy." Well, what was interesting is they kept the Premarin arm going. And that was the estrogen only arm. And these were in ladies that had a hysterectomy. And they followed them for 10 years. They had less breast cancer than the controls. Think about that one.
Yeah.
There's also been studies showing that bioidentical estrogen and progesterone reduce breast cancer. So I have never bought into this notion that God puts a hormone in our body that is cancer producing. Now, we do know that estrogen will stimulate cancer cell growth. So if I learn that a woman has breast cancer, of course, I immediately take her off HRT.
Okay.
I had a case, there's a gynecologist in town, Randy Randolph, we're buds and we practice very similarly. And I had a patient in who had a history of breast cancer, but it was over 5 years ago and it looked like they had gotten it all. And Randy had recommended progesterone to her and she was like, "Oh no, I've heard hormones are bad." And he said to her, "I've been doing this for 40 years. Almost every woman in my practice is on progesterone. The statistics are that 1 out of 8 women ought to be getting breast cancer." She said, "I see a tiny fraction of that. So I think that progesterone actually helps protect you." And if any of the listeners want to really study this, he's passed on now, but there was an MD named John Lee. And John Lee was a family practice doc who became interested in progesterone and just literally devoted his life to it. So this guy studied it up one side and down the other, wrote books about it. And his opinion was that if a woman was PR receptor positive with cancer, they ought to take progesterone. Now that's considered blasphemy. For full disclosures, they say, I was on Gary Gordon's chat site. I don't know if you ever knew who Gary was, but he had a wonderful chat site until the Fed shut him down, where these practitioners would all contribute from around the world to this chat site. It was the most incredible learning tool. And I put out a question in the group one time, and I asked them, I said, "Would any of you put a woman on progesterone and they have breast cancer?" And not one came back and said they would. In fact, one said, "I hope you got a good attorney." So, one has to use common sense with this stuff. But in my opinion, that bioidentical, properly balanced hormones, I believe, is protective. And that's not what conventional medicine would tell you. But in my experience, I can't remember the last time one of my ladies on HRT developed breast cancer, at least that we knew of anyway. So I think it's good for you.
So we were talking about hormone replacement therapy, and you talked about Premarin, and I'm glad that you talked about that, which is a synthetic hormone replacement therapy. But we're talking bioidentical here.
Correct.
And tell me the difference between bioidentical and something like what we were talking about that's synthetic.
Well, a lot of synthetic estrogens are found in your birth control pills. And if you look at a lot of the side effects of birth control pills, they're not particularly great.
No.
So
I couldn't take them.
Obviously, you don't want to get pregnant when you're not wanting the baby, of course. So that's an issue that each woman has to decide for herself. But Premarin is actually was obtained from pregnant mares. It's horse urine. And that's where the Premarin came from. And so it was over 100 different horse estrogens. Well, I prescribe estradiol, which is what your body makes. If you were to look at the chemical structure, it's the exact same stuff that your body makes. And in the laboratory, they can make this from soy or yam. And this is a little piece of information for you all. There are a lot of unscrupulous suppliers out there who will sell yam as a type of bioidentical progesterone or estrogen. Your body cannot convert yam into any of those hormones. Now, it's probably not going to hurt you, but you're not really getting very much. If it says progesterone on the package, then by law, it has to be progesterone.
And where does progesterone come from, even if it's biological?
That as well from yam and soy. If you look at the steroid pathway without going into depth, from cholesterol, we make pregnenolone and then progesterone. And from progesterone, we make all the other steroid hormones. So progesterone is really kind of like a mother hormone, which puts in a lot of built-in safety. Because if you give a end-of-the-line hormone to someone, it's almost kind of forcing their body a little bit to do a certain thing. But progesterone has a lot of safety in that regard. So they can make these bioidentical, what your body makes, in the laboratory, and then we obtain these from compounding pharmacies. But ladies, you can try. I mean, there's over-the-counter progesterones that are, somewhere in the neighborhood of 10 to 20 milligrams per dose. You rub it on your skin. They're creams. And sometimes that's enough. They can try it, and you can buy that at your health food store or online.
Okay.
And,
what are the symptoms of someone who needs progesterone? Because I know they put me on progesterone when I was having issues with sleep.
Okay. So one of the side effects of progesterone is it tends to be sedating. There's interesting, I don't know if you ever heard of any Michael Gerber stuff. He's an MD, and Michael been doing this stuff forever. And he always keeps a little jar of progesterone cream in his office. So if a patient comes in, let's say they're really very anxious or panicky, he'll just take a little dab of that and rub it on their arm. And within a few minutes, they just calm right down. So progesterone balances estrogen. So if you still have a uterus, you cannot or should not take estrogen alone, because estrogen causes buildup of the lining of the uterus. Progesterone thins it. So that's what that normal cycle is when you're premenopausal. Likewise, when you take it postmenopausally, you don't want estrogen to just keep building up the endothelial lining, because that can increase your risk for endometrial cancer. Progesterone is also very good, and both estrogen and progesterone are very good for your bones. So a lot of patients are worried about osteoporosis. So one of the treatments for osteoporosis is actually DHEA, progesterone, estrogen, and testosterone. Those four all help to build bone.
Wow.
So, so when you use the estrogen, progesterone, testosterone, that's going to just help with a whole slew of things. It's going to help you with your mind, with your bones. It's good for your heart. Testosterone is good for your muscle strength and libido. Generally, patients, they just feel much better when you do that.
Is that progesterone or testosterone? I heard you say testosterone.
Testosterone's good for, well, I put all three of those together. So testosterone's good for the strength and libido and that kind of stuff.
Oh, you're talking about osteoporosis as well?
They're all good for that. So, DHEA, progesterone, testosterone, estrogen, all four of those can help with osteopenia or osteoporosis, help to strengthen your bones.
Okay. So with people with, you said that people that don't have a uterus don't necessarily need progesterone.
That's correct.
And I think I heard you say that you can't have estrogen without progesterone if you don't have a uterus.
If you do have a uterus. So in other words, because the estrogen causes buildup of the lining, but if you don't have a uterus, you don't have any lining. Now, you have estrogen and progesterone receptors all over the place. You have them in your brain, you have them in your blood vessels. I mean, they're all over. So progesterone does a lot more than just help to protect the uterus. So even in ladies that have had hysterectomies, I still recommend progesterone.
Good.
Because it helps with a whole host of things.
Very good. And so with progesterone, and we haven't even talked about testosterone for women. You said earlier that the woman got man strength testosterone, good for her. But with women, we need testosterone too.
Right.
So the combination of all of these hormones.
Right.
So with the testosterone, how do we build these hormones without needing some either replacement therapy or bioidentical hormones, or how can we build this without doing the
Well, there are a few things that one can do. Let me pull up my little testosterone sheet here. Okay. So, because usually I do by replacement. There's a few things that tend to decrease testosterone.
Okay.
We want to try to avoid those. So one is stress.
Okay.
Or distress. So that you want to work on keeping that down. Excess alcohol. So as long as you keep, alcohol to maybe 1 to 2 drinks a day, that would not be excessive.
1 to 2 drinks a day is not excessive? Okay, I'll buy that.
There's actually studies showing everything has a bell curve, but some people, if 1, 2 becomes 3, 4, 5, 6, then, there's obviously an issue there. Yeah. Sleep disorders, so a lot of people are suffering with sleep problems. So that can tend to throw off your testosterone. Obesity will tend to lower it. I've got a number of other things. I don't know if you want me to just go through my whole list, but there's a number of things. So to increase testosterone, exercise. There's been studies showing that 4 hours a week of moderate exercise can help to raise it. Resistance training, so using some weights, light weights can help.
Okay.
High protein diet with allopurin. I had to look that one up.
Yeah.
It's OLEUROPEIN, allopurin. It's basically extra virgin olive oil. It's a phenolic that's in the seed of the grapes. It's a little on the bitter side, but somehow, I don't know how they came up with this study, but they found that combined with a high protein diet can help to boost testosterone.
Because I know that Dr. Sinatra, who was at the ACIM conference, he swears by drinking olive oil, but then you have doctors like Dr. Esselstyn and Dr. Furman, who says drinking olive oil is not good. Just eat the whole olive. Does that make a difference?
I'm not aware of studies that have been done comparing the two. I understand where Dr. Furman's coming from. But I think, too, that one has to look at practicality. Mm-hmm. Do you want to be eating a cupful of olives every day? I mean,
I would.
Maybe you could like to do that. There's calorie, there's high in fat and all that. So sometimes it's easier just to sprinkle some olive oil on, your salad or what have you. But I have no problem, obviously, with eating a whole olive, of course. Mm-hmm. Mm-hmm. So, of course, cutting back stress and improving your sleep kind of makes sense if that tends to decrease and improving that.
Yes.
And then there's about 10 different vitamins and adaptogens and things like that. The problem is that all these things are not going to probably change things all that much. And let me use males, for example, so we don't completely ignore the males in this conversation, all right?
Yeah.
So when you look at testosterone levels, most men typically let's say a 60-year-old guy comes in and he's just having trouble with erections, his libido's in the tank and that sort of thing. He'll have a testosterone level usually around 100, 200, somewhere in that ballpark. Well, we're shooting for 700 to 1,000. So you'll see all these things on TV. Oh, this boosts testosterone 50%. And you think, oh, wow, that's tremendous. Well, to take somebody from 100 to 150, I mean, that's a yawn.
Mm-hmm.
So when I treat a guy, I'm getting his levels up 5 to 7 times what they were. And the only way to do that is replacement, really.
Do you do the pellets or do you do the creams? Which one do you prefer?
I do the creams. Now, I'll tell you something interesting. This is an interesting little story. Well, first I got to tell you another quick story. It's kind of interesting. I'll get some of these little old ladies in, and I'll put them on testosterone, and they're very happy. And usually they come back and they go, I got to get Bill in here. They need to be serviced. That's kind of funny. But I read about Clomid or clomiphene.
Yeah.
Which is used in fertility stuff for women. And when I first started prescribing this, I used to get calls from the pharmacy because these guys would come in with these scripts for Clomid. And they would ask me, say, are you sure you want to give this guy Clomid? Well, Clomid acts virtually identical to luteinizing hormone. Now, luteinizing hormone, or LH, is made in the pituitary. And this is what tells our reproductive glands to work. So luteinizing hormone tells the testicles to make more testosterone. So on some level, Clomid is actually probably the best way to get the body to naturally produce more testosterone. And I'd say probably 30 to 40% of the guys that put on Clomid are satisfied. The rest have to go to a cream or a shot.
So do you recommend that for women? Clomid for women? Does that not work the same?
No, the pathways are different because women don't have testicles, so the LH is going to operate differently in them. Maybe some do, but anyway. Yeah, so the mechanism...
It's a totally different show.
It's a totally different show, yeah. You can't really use it well for the ladies. So this is something that your listeners might be interested in. So if you do blood tests, so the guys were shooting for testosterones in the 700 to 1,000 range. Mm-hmm. Women, estrogen and testosterone were shooting for around 50. And the units are pretty standardized from lab to lab, so you don't need to memorize picograms per ml and that kind of thing. So estrogen and testosterone are about 50, and progesterone's about 6. Now, I learned about this from Randolph, because Randy's really made kind of this one of his life missions. He's written books on hormones and all that stuff. And I have followed this, and it's worked really well over the years for my patient. I've been doing this for probably 15 years. And so those numbers seem to pan out pretty well. So if, for example, I get a patient in and their estrogen and progesterone are very low, but their testosterone is maybe 27. I may not put quite as much testosterone in their cream.
You're talking about a woman. You're talking about a woman.
A woman, yeah. I'll scale it down. I know I'm kind of jumping back and forth a little bit. I'll scale that down a little bit based on them. Guys, what I normally do is I'll start out with, say, I'll start out with a Clomid. I'll see them back in a month. If they go, yeah, it's not really helping me, then I'll talk with them about going with either a cream or a shot. And the shots work best.
Are the shots synthetic, or are they bioidentical as well?
Oh yeah, this is all bioidentical stuff.
Okay,
yeah.
What are bioidentical testosterone made of?
Well, they make it in the lab just like with the other. I assume, I've never studied that, but because of these pathways, they use yam or soy as the core grouping, and then they've got laboratory techniques that they can pull different groups on and put other groups on to create that actual bioidentical molecule.
Yeah.
And So, it works well. And then the guys just 1 shot a week. And if they can get their wives to give them a little shot in their backside, I tell them, try to do it when she's not angry. Or I'll have the guys do it in their thigh muscle. We teach them how to do all that stuff. Uh-huh. And I'll tell you, they really notice it.
Interesting. I'm curious about that, and I think we should do a whole show on hormone replacement therapy for men, and because we've just dipped the toe into the stream here because it's a lot to know. Right. I do want to acknowledge all my sponsors before we continue to speak, because it is so important. If it weren't for our sponsors like Dr. Stephen Grable, who's in Jacksonville Beach, Florida, worth the drive for all of you that are near the area, or maybe a phone call for Dr. Grable. And you could always email him. He's so generous with his time at DRS, as in Stephen, Grable, GRABLE, @gmail.com. You can email him there, or you can go to his website as well, which is drgrable.com. And it's drgrable. I'm going by my memory because we email a lot. I go to your website quite a bit. Mm-hmm. And so I want to encourage you guys to go to whenyouneedafriend.com, become a subscriber. When you become a subscriber, you will get all the information for all our teachers that are in the classroom. And being Dr. Grable, you can find him, you can call him at 904-247-7455. When you call their office, let them know that you saw him and you want to thank him because he's taking the time to share his love and knowledge in the classroom. Let him know where you heard from Dr. Grable. And so while you're at whenyouneedafriend.com, please like, follow, check out all the different social media, subscribe in my YouTube channel, follow and social media and like. And also click onto my sponsorship page. Sponsors like Liberty Health Share, Keep Me Safe Organics, First Alternative Care, the pharmacy, Live Longer Medical, and of course Ground Therapy, that I'm really excited as well. There's my newest sponsor and passion that I have as well. And I want to encourage you to become an enrolled student as well, because as a viewer and a student of the classroom, we all can help out, grow, and expand this information. Dr. Grable, I'm really excited every time that you come on, because I know, that you're local, that you're accessible, and you really care for your patients. You really do. And so before because we're getting towards the end of the classroom or the podcast, really. Do you recommend that people go on hormone replacement therapies?
Well, if they are asymptomatic, in other words, if they are not having any perceivable symptoms, that'd be a great muscle test question. If they have trouble with their sex drive, if their bones are weak, if, say, dementia's run in the family, that sort of thing, then it might sway you to then want to look more into doing HRT. Mm-hmm. But it's an individual decision, that everybody has to make. And some people will just try it. We'll check levels and they'll try it for a while. And because a lot of times people don't know how they are until they start feeling better.
Mm-hmm. Of course.
And then realize, oh gosh, I didn't realize I was back here and now I'm here.
Yeah.
Kind of thing, So, it's just because, it can help, like testosterone, help with your muscles, and can help to boost growth hormone and all kinds of stuff we just didn't have time to go into tonight.
I know. We can do part 2, Dr. Grable.
I think it's important to just listen to your body. And I think I always keep coming back to that, because that your body will not steer you wrong.
Correct. So. Yes. Okay. So you had talked about giving a testosterone shot. We were talking about men. Do you do testosterone shots for women, or do you suggest that you look at their hormones and you do a little bit of each one just so that you can create balance in the body for a woman?
Well, normally I'll mix the 3 together in a cream,
which is what I'm getting.
And then some ladies, you know, it becomes a confusing picture for them. So then I'll separate them so that we can adjust each individually. I have a couple of gals who came in who were another doctor who prescribed shots for them, and they swear by it. And so I prescribe the shots for them. But in general, ladies really don't seem to need it. Usually you can get their levels up. You know, you're not trying to achieve, we're talking a level of 50 as opposed to a level of 900. Mm-hmm. So, you know, you can really get that in quite nicely with just the topical cream. And I never really answered your question about the pellets. Mm-hmm. I know there's a lot of docs out there doing these. I mean, that's fine if they like them, if the patients like them. In my personal experience, I haven't found too many patients that have really been excessively thrilled. It is a little bit of a surgical procedure. You have to make an incision in the skin. And if you sort of guess wrong, they're stuck for about 3 months.
Yes.
That dose.
I could tell you stories after we finish the podcast.
Yeah, and that's one of the bugaboos. So I toyed with learning this years ago, and I thought, you know, I've never really found it necessary to do that. And it's.
So you think the creams and the injections injectables are better?
Yes.
Yeah. So what advice do you give to women when it comes to making the choice for hormone replacement therapy, you know, risk or benefits? And I know we're down to the last 2 minutes for the podcast. You know, do you feel that there's any risk involved? Because there's a lot of fear out there.
Probably it would be a wise thing if, for example, if there's breast cancer in the family, to get your BRCA1 and 2 checked, the genetic tests, like the BRCA. That's the Angelina Jolie. You've probably heard, you know, that story. Mm-hmm. You know, if they're BRCA1 or 2 positive, you know, that may make someone decide to not go down the HRT pathway. I tend to believe that these things are protective. Mm-hmm. Maybe at the end of the day, it turns out that maybe these women ought to really be on the 3, that would be protective. See, the problem with a lot of the data is that data is being done with things like Premarin or Provera. And so people will throw terms around. They'll just say estrogen or progesterone, and they're not talking about the bioidenticals. And so in a lot of the studies, it gets very confusing because we're kind of comparing apples and oranges. And, you know, it's...
But it's safe. It's safe.
I believe.
Yes, it is. Well, Dr. Grable, I know we're going to continue after the class, after we finish the podcast here. For those of you who are listening on podcasts, you can always join us at facebook.com/Lillian's radio show. And for those of you who watch us on YouTube, you can watch us live interactive and where we all learn together. Dr. Grable, thank you so much for everything that you do. And I really do appreciate you.
You're very welcome. Good to talk to you, Lily.
Yeah. Please remember, we'll be right here waiting for you worldwide at whenyouneedafriend.com. This is Lillian McDermott and Dr. Stephen Grable wishing you love, peace, joy, and unexpected abundance. Make it the best day ever.
The opinions and advice expressed on the Lillian McDermott radio show are intended for the individual callers and guests on the program and are presented to our wider audience solely for general educational purposes. Please act responsibly and consult personally with your own medical, psychological, or nutritional expert before taking any steps to improve your life.
If you have any questions let me see. Let me make sure I'm muted. I'm not muted. Okay. If you guys have any questions today for Dr. Grable, just type in a Q and write your question and I will ask it. We have a few minutes left and if you ask a question within that time, we can more than happy to ask the question. So safety is important. So when you talk about injectables, you were talking about men injecting testosterone. Would men inject estrogen? Would they inject progesterone? Or would that be something they would use as a cream along with the shots?
Well, in general, what happens is if you put a male on testosterone, usually you have to work on keeping the estrogen down, because what happens is testosterone goes down through what's called an aromatase pathway. and it can turn into estrogen. So I try to keep the estradiol levels around 20 in a male. And it's not uncommon at all to see it, at 60, which is too high. Mm-hmm. So what I'll do is I'll put them on a aromatase inhibitor, such as anastrozole, which actually is used in breast cancer. So if you think about it, they actually kind of make sense. So a lot of the treatments for breast cancer are aromatase inhibitors. And we'll see it come down nicely. Sometimes a couple of pills a week is all they need. Mm-hmm. So I've never given a man estrogen. We certainly need enough of it, but we make it in our fat cells.
And we get it in our food supply.
Yeah, well, the xenoestrogens, are also stimulating estrogen receptors and so forth. But rarely, to my knowledge, would a male need estrogen, or at least supplemental estrogen, because the estrogen also tends to balance with or counteract the testosterone. So, it's all about balance, whether you're talking about a male or a female. Mm-hmm. If you get too much testosterone, people can get kind of aggressive, that sort of thing. Usually it's the wife that'll come in and say, we need to cut back on Bill's testosterone.
Yeah. Poor Bill, whoever he is.
Poor Bill. Howling at the moon at 2 a.m, kind of thing. But yeah, it's so, and then I haven't used a lot of progesterone in male. It's an interesting thought because it is, men need progesterone just like, maybe not quite as much as women, but they do need it. And your body does make all of the other hormones from progesterone, just like ladies do. Mm. So we make testosterone from progesterone. It's in the upstream,
Testosterone from progesterone. Got it. It's so there are some what they call bioidentical hormones, like the estring. Is that a bioidentical hormone? Estring?
Yeah, that's estradiol. So it's just just a different delivery system. Mm-hmm.
Okay. Then there's Bibel-dot that I've heard of.
Right. That's estradiol.
So that's 2 estradiols. Right. Okay. And then progesterone, that you can get that compounded and in pill form and all of that. Is there anything other than the testosterone that would be either an injectable or as a cream?
Well, you can put, you can have things compound, like you can put some DHEA in. What we've been doing is with the pharmacy we use is we have testosterone compounded with a little DHEA, mm-hmm. which, we didn't have time to go into DHEA tonight.
Mm-hmm. We have to do part 2. What can I say?
It's a good kind of I call it anti-aging hormone, kind of an oomph hormone, as I call it. Mm-hmm. So
can women take DHEA?
Oh, sure. And the dose is, if you wanted to try, 5 or even 10 milligrams of DHEA, you want to use what's called a micronized form because that's better and absorb better. And your body can make some testosterone from that. So, for example, I've done this where I'll have a lady.
Did you say decrystallized? What did you just say?
Micronized.
Micronized. Okay.
Micronized. Okay. So your better DHEAs will say on the label micronized DHEA.
Ah, good.
So let's say you measure levels, and let's say their estrogen and progesterone are pretty good, but their testosterone is low. Well, I may recommend just try a little DHEA first and, kind of see what happens. Or if let's say I put them on estrogen, progesterone, but their testosterone is near normal, I may leave the testosterone out of their formula and maybe just add a little DHEA. Some will use all 3 plus DHEA. There's different ways to kind of juggle things. But you can get DHEA over the counter. It's really kind of amazing that you can buy this hormone over the counter.
But you don't suggest people just treat themselves over the counter. How important is testing?
Well, 5 or 10 milligrams of DHEA, it would be awfully hard to get yourself in trouble with that.
Okay.
Whether you're a male or a female. But, kind of knowing where you're at and having somebody monitor you, I think is always a wise thing to do. Okay. But if the gals wanted to try a little over-the-counter progesterone cream, see if it helped them sleep a little better or calm them down, I'm fine with that. That's not a big deal.
Okay, and so what about progesterone cream? Like what would be the dose for that?
Well, they're typically, when I prescribe it, I will usually give about 100 milligrams topically daily. So they'll be, I put in 200 milligrams per ml, and then I use about half that amount throughout the day.
Okay.
So, and I usually like to, and with my ladies who have a uterus, I'd rather overshoot than undershoot, because I want them to make sure the uterus is protected.
Okay, so that would protect that. Okay, so is there anything else that we can take to kind of help keep the balance?
Well, you asked before about things that can boost testosterone, so we could mention a couple. So DHA is one. Ashwagandha is a good adaptogen. So for people that just feel like they're under a lot of stress, that they need a little support, that is a great adaptogen that's out there, that you can get that online or at the health food store. Ginger is very good, the spice.
Okay.
And there's another one called Mucuna pruriens, which is a mouthful.
Not Mucuna batata.
No, Mucuna pruriens, yeah. And that one actually helps to make dopamine, which is that feel-good neurotransmitter. In fact, I just gave a talk at Weiss Pharmacy a couple of nights ago on neurotransmitters. And I didn't know that testosterone increases the expression of dopamine. Dopamine's that one that, people, Ritalin, coke, cocaine, and just addiction. It's the pleasure neurotransmitter. It helps us feel good.
How much can you take? What's the most you can take without it being?
Of Mucuna? I would have to look it up. I just follow it as on the bottle. I mean, you can get that stuff over the counter.
Yeah.
But I'd have to, I don't know the dose off the top of my head, but yeah. You could
Pretty cool. Pretty cool. Anything else?
I think we kind of hit some of the main things here.
So progesterone, that is
one of the things that also I think is really good to know is these 4 different hormones are also very good for helping protect the brain. They're very good for neuroprotection. So that's something too that I would, and estradiol also helps to boost dopamine. So both that and testosterone help along those lines.
Yeah.
There's a lot more we could go into.
I'm telling you, we need to do it.
Because you don't want to get people too overwhelmed, and you try to give them too many facts and so forth, and it just,
Yeah. Well, the good thing about this is that every one of us will hear something that you might say and go, the little antenna, there's that muscle testing in the brain that goes,
right.
Let me move towards that. So I really appreciate this intro to the hormone replacement therapy, because a lot of things, like you'll have someone say, oh, hormone replacement therapy is horrible, because they want to sell more synthetic replacements. And so we have to do our own homework to say, okay, what works best for us? So bioidentical, and what I'm hearing you say, which I'm really excited about, works with our body naturally.
Right.
And it helps enhance, and if we're feeling low libido or tired or brain fog, there's so many different things. And can you have all these things and still be in your 30s? Could hormones be helpful to someone, bioidenticals, when someone is even younger than menopausal, premenopause? Because now our food supply is so devoid of everything.
Oh yeah, I've given teenagers progesterone for PMS, and have had very good results with that. So very often you'll hear this term estrogen dominance, and there's been some debate about how true that is and so forth. But it's interesting. If you look at levels in a premenopausal woman, I usually check it around day 21 of her cycle, with day 1 being the first day of her period. Very often you'll see an imbalance. You'll see the estrogen is high relative to the progesterone. And so we'll put them on maybe a little progesterone cream, or typically like a pill.
Mm-hmm.
Prometrium is one of the common trade names. That's a bioidentical progesterone.
Mm-hmm.
And I'll have them take one every night during the second half of their cycle,
Mm-hmm.
and then just stop when they start bleeding. And oftentimes that does wonders for them. They feel a lot better, a lot calmer.
Great tip. Great tip.
Yeah.
Yeah,
Yep.
you pulled that one out of the hat. That little rabbit is really good, because there's a lot of people that they are expecting to feel a certain way by a certain time, and usually they're right. And I don't know if there's anything that we can do. So it's nice to know that women who are still getting their period could work the system. I really think that the next time we talk about this, Dr. Grable, we really need to talk about like little tips and things that we can do to kind of like allow this season in our life, time a month in our life, depending on if you're premenopausal or postmenopausal or even pregnant, because we didn't even talk about pregnancy today. But to what are some of the tips and the 10 tips that we can do to kind of minimize the symptoms of a hormone imbalance? So maybe that'll be the next, tips on hormone imbalances and how to kind of like work with someone like you to help out. Once again, Dr. Grable is at Jacksonville Beach, and the website, you can find him on the internet as well. And you can also find him at 1504 Roberts Drive. That's in Jacksonville Beach, Florida. You can find him at Complementary Care Center, which you can search for that, or you can enter drgrable.com, and you will be able to see all the different sources, all the different services, and how even IV therapy. Because I noticed that IV therapy, vitamin C's, that will help also with the hormones. Did I read that correctly, Dr. Grable? Perhaps not. I just saw that there were different supplements that can help with
Well,
testosterone.
yes, if you look at, let's see, I think it was, with testosterone, vitamin D, zinc, calcium, boron, manganese, folate, A, C, E, all of those can help boost testosterone.
And the E has to be natural E, because there is a synthetic E that does not work. And it's the natural form of E. And how do you know if it's a natural form of E in the bottle, Dr. Grable? Is
ideally you want it to have at least
tocopherol?
all 4 tocopherols.
Tocopherol.
And if you can find one that has all 4 tocopherols and all 4 tocotrienols, that's ideal.
Tocotrienol?
Tocotrienols. Yeah, there's a company called AC Grace. They had a product years ago. In fact, they still sell it, called Unique E, but it no longer has all 8. I think it was just a cost issue, because tocotrienols are very expensive. And if you're selling something that's $100 a bottle, people aren't going to buy it. So, but ideally, if you can get all 8 components of E, that's ideal.
Yeah. Dr. Andrew Saul says that if you go on to vitamin E, instead of going on blood thinners, that vitamin E, the natural vitamin E, is really good for people that don't want to get on blood thinners, that this is something very good for them as well. So there's so many things we don't know, Dr. Grable, and I'm so grateful when you come on and help us learn new truths about how we can take our health back. So thank you so much, Dr. Grable. Is there any last words to share with our friends, our viewing friends?
I think we kind of hit the highlights, I think.
Okay. So I want to thank you, and thank you for watching today. Please share this video, like us, make comments below, and let us, if you have any questions or any topic that you would like for Dr. Grable and I to speak about, please share that too, because we're all about This is our classroom, and it's all about growing and helping each other out. So thank you so much. I'm just going to say goodbye to all of you on Facebook and also YouTube. Thank you for watching.
Good night.